If you pop an aspirin at the first sign of a headache or reach for the nearest pack of ibuprofen when you've got a cold or flu, then you're not alone. It's estimated 1 in 3 people would take the first available medicine.
A survey also found that a third of UK adults don't know the difference between many common medicines, and with so many of them being used incorrectly or under the assumption that one pill cures all, Dr. Chris is here to clear up some of the confusion. So, where do you want to begin? Should we begin with paracetamol, seeing as that's the one you normally turn to?
Yeah, that's right. And people have the sort of perception that paracetamol isn't very good at painkilling. It's a very good painkiller, but you have to take the right dose. And the normal tablet's 500 milligrams, so 2 of those taken up to 4 times a day, but certainly 4 hours between each one. But now, some caution with paracetamol. If you've got liver problems, or if you're a strong drinker, you may have liver problems that haven't been diagnosed. Paracetamol can be toxic to the liver, so you do have to be careful. A very effective painkiller, for adults and children.
It's often mistaken with the fact of not being a good painkiller.
That's right, and it's one of the best. The other thing about paracetamol, you very often get it combined with codeine. Oh, now here's a problem. Codeine, very effective painkiller. You may not be reading the label, and you're taking your tablets and you're giving yourself codeine. Codeine can have an effect that gives you a bit of a, oh, that's nice. And it's unidentified, the size of the problem out there. People buying tablets that contain codeine that are abusing it because of it's got addictive qualities. You shouldn't use it for more than 3 days. So look at the label. If there's codeine in there, be very, very careful.
And when should you take it?
Well, I think paracetamol, basically any pain. Any pain, it's very good for. And if your first dose doesn't help, well, 3 to 4 hours later, you take a second dose.
So reducing fever, headaches.
It works at reducing fever, I think most users of paracetamol would know this. It's good for fever, good for headaches, colds and flu, aches and pains problems.
Okay. But there's no point taking it to reduce arthritic pain or muscular injuries.
Well, no, it does ease the pain, but there are other medications out there that ease the pain and stop inflammation, which is present in joints and muscles.
Okay. Aspirin.
Yeah, now aspirin, of course, was a very popular painkiller, right? We used to give it high doses for arthritis, and very popular for control of fever, but should never be used in under 16s. But now, because aspirin can cause problems, if you've got asthma, it can trigger an asthma attack. If you've got indigestion or you've had peptic ulcers, you can't take aspirin because it can erode the lining of the stomach and the gut. So it can cause ulcers and can cause gastrointestinal bleeding. So we've left aspirin behind as a pain reliever, and we're basically now using it. Its most popular use is in, it's called antiplatelet medication. Now, what this means is, imagine you've got your artery, and the arteries are covered with fatty deposits as you get older, hardening of the arteries. Clots can form in the lining of the arteries. The clots are formed by platelets coming together, tiny cells that start the clot formation. So if you've got narrowing of the arteries, then taking aspirin will actually stop the platelets sticking together and prevent a clot developing. So it's used now 75 milligram low dose aspirin, 1 a day, for patients with known coronary artery disease, patients at risk of coronary artery disease, to take 1 a day. Now, what's interesting, some experts are saying everybody over 50 should take a 75 milligram tablet of aspirin every day because of its preventive effects against these clotting diseases like heart attack, stroke, etc.
But not for headaches, a cold, a cough, or any type of muscular pain?
No, I don't think you should consider aspirin on the horizon. It's now being looked at very seriously. Its effects in reducing the risk of cancer, bowel, lung and prostate.
Early days on that research.
Yeah, but reducing cancer by 25 to 30%.
Wow.
Wouldn't a drug?
OK, well, let's talk about ibuprofen now, because this is that anti-inflammatory drug that you were talking about. What is it good for?
Yeah, it's a non-steroidal anti-inflammatory drug, so it stops inflammation. So very good for painful joints or inflammation anywhere. Also good at reducing fevers, in children. Now, it's the same as aspirin. Be careful if you've got asthma. Be careful if you've got a history of indigestion or or previous ulcers, etc., because that can cause erosion of the lining of your stomach and your intestines.
So the pain-killing effect begins pretty quickly after you've taken it, but the anti-inflammatory effect can take longer.
Yeah, it can take a while. It can take anything from 1 week up to nearly 3 weeks to have the inflammatory effect, but it's worth persisting with because it's a very safe medication, and you've got pain relieving and anti-inflammatory effects. Now, with the anti-inflammatories, there's been research to show that they can increase the risk of heart attack in patients who take high dose for long periods of time. So if you're taking it for a long period of time, discuss it with your pharmacist or your GP.
And not recommended if you're pregnant?
Not in pregnancy.
And also
Paracetamol's okay in pregnancy, but not ibuprofen.
You should take it with food as well, shouldn't you?
Yeah, like aspirin, you take it with or just after food, so you don't get the adverse effects on the stomach.
OK, we have to talk about antibiotics. That's the big one, isn't it?
Yeah. Now, antibiotics are for killing bacteria. You go to your doctor, you've got a throat infection, he has a look at it, and he just says, take paracetamol, plenty of fluids. Where's my antibiotic, doc? Well, you're not having one, sorry. No, I need an antibiotic. Antibiotics kill bacteria, have no effect on viruses, and the doctor will decide, is this a viral infection or a bacterial infection?
How do you know the difference between that?
Well, I mean, if you had a viral infection of your throat, it would just be red and inflamed. If it was bacterial, you might have yellow spots on it. It's very obvious to a doctor checking. But things like cystitis and chest infections, they're usually bacterial, and so an antibiotic would be indicated. You can't buy them over the counter. You've got to rest the decision with your GP, and he'll make the right decision. The problem is, patients may be put on antibiotics and they don't complete the course. They feel better after 2 or 3 days, stop the course, still some bugs going around the system. The bugs have got used to the antibiotic, they multiply, and they develop resistance to that antibiotic, which is a huge problem.
So you should, and you can't stress this enough, you should always finish the course, even if you feel better, and don't ever borrow any of anybody else.